Good afternoon. Thank you very much for joining us. We appreciate your attendance today. My name is Scott Harris. I serve as State Health Officer with the Alabama Department of Public Health. I'm joined by Dr. Mary McIntyre, who's the Chief Medical Officer with ADPH, and we appreciate your time to come and hear this press conference today about measles in Alabama. As you know, just as recently as yesterday, we had no confirmed cases of measles in Alabama, but actually just this morning, we were notified of a single case of measles in an infant under 1 year of age who was not previously vaccinated. This occurred in St. Clair County, and we are just now in the earliest stages of investigating this. This is a confirmed case of measles based on the CDC case definition, although there's still further investigation that we will do and additional testing that we will do to ensure that we have made the correct diagnosis. Out of an abundance of caution, we feel like it's appropriate for us to bring that news to the public at this time so that they understand the situation. You may be aware that there have been, for months now, many reports of measles on social media and in certain news outlets, and none of those have proven to be positive so far. So we felt like with this initial confirmation that we wanted to bring that to you as soon as possible. We know that this infant was considered contagious beginning on April 23rd and was probably contagious through May 1st through yesterday. We have our epidemiology staff working with the family and with the medical provider to investigate that further to try to determine whether there could have been additional exposures. At this time, we do not have information about additional exposures. We do know that this infant was cared for by a medical practitioner, and our knowledge so far indicates that that practitioner considered this diagnosis and took all the appropriate steps to protect other patients and other members of the public, but we continue to investigate that. We anticipate in the next 24 hours we will have more information about this case that we can make public, and particularly we'll have information for the public to learn about whether they could have been potentially exposed and what other steps need to be taken. It's very important to remind people at this time that the best way to prevent measles transmission is to be vaccinated. I want to review for you again the vaccination recommendations that we have. All Americans born in 1956 or earlier are considered to be immune to measles and do not need additional vaccination. For those born in 1957 or after, 2 doses of the live measles vaccines are needed to confer immunity. So we would encourage everyone to check their vaccination status and try to determine that any way that they can. If you're absolutely unable to confirm your immunization status, then you need to receive an additional measles dose. There's no harm from receiving additional doses even if you've been previously fully vaccinated. The measles vaccine generally is widely available. It's not expensive for most people. It's covered by virtually all insurance, and there are no shortages of the vaccine. The vaccine is also known to be very safe and with only very minimal side effects, despite some of the stories that you may hear. We feel very comfortable that the measles vaccine is safe and effective and should be widely used by anyone who's eligible to receive it. That's all the information that I had from this prepared statement. We'll be issuing a news release later today, as well as a Health Alert Network message that goes out to medical providers in the state. We'll be happy to answer any questions if there are any.
As it relates to the confirmed case, what should the public know in relation to measles?
I think the most important thing to know about measles is that there's a very safe and effective way to prevent measles, which is to become immunized. We know that if you're unaware of your vaccine status, becoming immunized within about 48 hours potentially of exposure will protect you. The measles vaccine is highly effective. 1 dose gives better than a 93 or 94% protection, and 2 doses, which is the recommendation, gives close to a 99% protection.
Since this case was found in an infant, is it more common in infants, adults? What's the age?
Yeah, that's a great question. Remember that measles is a live vaccine, and so for that reason, it's recommended to be given to children who are 1 year of age or older. Most children receive their first measles vaccine somewhere between age 12 and 15 months, and then they receive their second vaccine around the time they start school, so around age 5 or 6. So this is a case of an infant who had not yet become old enough to be immunized. This is perhaps a little bit different situation from what's going on throughout the country. As you know, there are around 12 or 14 outbreaks in different parts of the country, but particularly involving the state of Washington and in the state of New York. Most of those cases associated with those outbreaks were international travelers who were older than 1 year of age, but who were not vaccinated, and they brought that back in, sometimes into communities where there were a large number of unvaccinated people.
Was this child in an environment like a daycare or anything like that, that possible more exposure to be?
We know that the child was not in a daycare. We don't have additional information about any other potential exposures, but we do know that they received advice from their practitioner to stay home and self-isolate, which is very encouraging. We're still working to find out for sure that that's actually what transpired, but that was the advice that they were given. And that's all we know at this time. I can tell you that the child was not an international traveler. We asked that question as well, and the child has not been out of the state.
As health professionals, what do you say to people? There's this debate around the country about whether to vaccinate or whether to not vaccinate. You have a group of people out there that are considered non-vaxxers. What do you say to them?
Yeah, there's no credible science that supports not vaccinating with the measles vaccine. It's a very safe and effective vaccine. It works very well. The side effects are minimal. There's I'm sorry, let me collect my thoughts just for a second. Autism has frequently been associated with, in the popular press and with social media, with the measles vaccine, and that's totally discredited and unproven. There is absolutely no link between measles and autism or any other chronic medical conditions that we're aware of. This is a vaccine that everyone should take unless there's a true medical contraindication. There are some people with weakened immune systems, perhaps because they have cancer or other immune situations, and so they can't receive the vaccine for that reason. And then again, we don't give it to children who are less than 1 year of age, but otherwise it's safe and effective to every person.
How would you advise those persons or person who want it to be tested to ensure or to make sure that they don't have the measles?
It's important to understand how measles appears clinically. Typically, measles starts off with a fever and can be a very high fever, sometimes as high as 105-degree temperature. Within a few days, people begin to develop cough and congestion, runny nose, watery eyes, and then conjunctivitis, which is redness of the eyes. And then within the next few days after that is when the characteristic rash appears. If you have any of those symptoms which would make you wonder whether you have measles, the most important thing to do is stay at home and contact your healthcare provider. We certainly would advise against going out in public, going to a doctor's office and waiting in a room full of other people who may have other illnesses as well. So talk to your healthcare provider. All right. Do we have any other questions? We will be making further announcements, and by this time tomorrow, we hope to have more information specifically about this particular case and whether there are any other exposures that we can anticipate. I do want to point out sometimes the terminology gets confused. This is not an outbreak situation. An outbreak situation is defined as multiple cases, more than a single solitary case. So we are now one of 23 states that have reported cases of measles, but this is not an outbreak situation in Alabama. All right. Anything else you would like to add?
No, the only thing I'd like to add, and he's covered it, is this is an opportunity for those persons who don't know their immunization status or that are really not clear on their immunization status to actually go ahead and contact their providers or even to see if they can obtain information, but there is no harm in getting vaccinated. And I do want, even though we're focused today on the measles, is we do have an outbreak situation going on with hepatitis A in North Alabama, and this is also an opportunity that people need to actually take to go get vaccinated if they're not vaccinated against hepatitis A, because we have more than 50 confirmed cases of hepatitis A in the state of Alabama currently that are associated with the outbreak.
Thank you. All right. Thank you all very much. We appreciate your attendance today.